Hello and welcome to the Citizens Jury. Thanks so much for participating. My name is Jackie Norris. I'm a registered veterinarian in New South Wales and I practice in small animal medicine. I also work full-time at the Faculty of Veterinary Science, so I teach the veterinary students about infectious diseases of animals and also about antimicrobial resistance. And in those two major areas I also do research. My job today is to remind you of the close linkages between human health and animal health, give you some examples of how antibiotics are used in veterinary practice. Some of those will be really obvious to you because you've got an animal at home. Others you might not have even thought about before. We'll discuss current use of antibiotics in food-producing animals, why they're used and how they're used, and some insights into the level of antibiotic resistance in Australia in food-producing animals. Then we'll talk about how the veterinary profession and maybe the agriculture industries might be contributing to antimicrobial resistance. And then I'll give you my take on some of the proposed questions that you're expected as jurors to answer. So whether you're an animal lover or you're not so keen on animals, they actually play a really important role in our lives, and their health is actually very closely linked with our health. So some of them are companions. They share our house, like a cat or a dog or a guinea pig. Some of them provide a service role, for example, horses that are ridden and dogs that provide a service role in terms of guide dogs. They play a really important role in production of food, so chickens, eggs, milk, meat, and also play a very important role in the production of fibre, such as leather or wool, perhaps the jumper you're wearing today. Our native animals play a very important role in the health of our bushland and are part of a very complicated ecosystem. So how are antibiotics used in veterinary practice? Some antibiotics are given topically for things like ear infections or skin. Other times it's more appropriate to give an antibiotic orally or by injection, and it really depends on the location of the disease that you're dealing with and the severity of that disease. In veterinary medicine, sometimes there's issues around the ease and safety in treating a patient orally. So sometimes that's because they're a wild animal, other times they're just cranky, or in the case of a little guinea pig like this, it's just very difficult. With medications that are given to production animals, there is a required withdrawal period. What this means is there's a period where an antibiotic cannot be given, so that when that animal goes to the abattoir or is milked for milk production, then there'll be no residual antibiotic left in those products. It's very important to remember that animal owners and producers already pay the full cost of antibiotics. There is no cost reduction by the pharmaceutical benefit scheme. Those antibiotics are sold to the owner or producer by the veterinarian most of the time, and occasionally we may send a prescription to a pharmacist for the owner or producer to pick up that antibiotic. It might be because it's not kept on the shelf, or we need a special formulation like a chicken flavoured drops for cats or something like that. Veterinarians are the only legal prescribers of antibiotics to animals in Australia when the antibiotic is being used for therapeutic, so that's to treat the animal, or prophylactic, so that's prevention of a disease in that particular animal. So unlike many other places in the world, they're not sold over the counter in Australia, and it does legally require examination by a veterinarian. So one of the most common reasons we might use an antibiotic on an animal is to treat an individual animal where there's evidence of a bacterial infection. So that's called therapeutic use, and it goes across all animal species. And sorry about the gory photo there, but this shows a foot of a young cat who'd been bitten by another cranky cat, and you can see the severity of deep tissue infection that we see there. So a veterinarian usually requires evidence that infection is present, and in this case clinical signs. And trust me when I tell you that this would really smell. So smell is part of the clinical sign seen. And other times we would require laboratory diagnostic tests, including examination of the fluid under the microscope, as is seen in the little photo at the top where you can see white cells and bacteria, And culture of the body fluid or tissue is also important. It's important to remember that the cost of these tests are quite expensive. All costs are paid by the owner or producer, and sometimes that limits our ability to test before we use antibiotics on a particular animal. So there might be circumstances where we need to use an antibiotic on a group of animals where there's an outbreak of a contagious disease. So one example might be strangles in horses, where it's caused by a contagious streptococcus infection. And in the early stages of diseases, just when they're getting a fever, we actually use antibiotics to help stop the infection actually developing. We also might use antibiotics in groups of animals, for example, in feedlot cattle. So these are animals who might be transported from the farm that they grew up on to a feedlot just prior to slaughter, where they may be given antibiotics because of an outbreak of respiratory disease. And the same goes also for dairy cattle. So where there's outbreaks of mastitis, groups of animals might be treated with antibiotics. So sometimes antibiotics are used in veterinary practice to prevent a bacterial infection occurring in an individual animal, and that's when they're undergoing some kind of procedure like surgery or after some kind of event like a trauma where we know there's a high risk of infection, and this is called prophylactic or preventative treatment. It might be that they're undergoing a surgery to correct a broken leg, or they might be undergoing surgery to move a foreign body from an intestine, like in the little cat up the top. And the little cat down the bottom actually got some severe burns associated with the dishwasher, where it spent a small amount of time in a dishwasher. And so that cat is at great risk of getting infections of the blood, and so would be treated with both topical and injectable antibiotics. It's important to note that we don't use antibiotics for routine desexing procedures. So how are antibiotics used in food production in Australia? There's two major contexts. The first one is where feed and water contain low concentrations of an antibiotic, and it's used to increase the efficiency of food conversion. So it's otherwise known as a growth promoter. So these are ones that don't actually have any direct benefit for that animal, but actually improves productivity, as in the amount of meat being produced. The other context is preventing disease, and I'm going to talk about that in the next slide. So Australia is one of the leading countries in its low use of growth promoters. So there is a list of drugs that were used between 2005 and 2010 in Australia in production animals. It's important to note that none of these are used in human medicine or are of any critical importance to human medicine. Previously, other growth promotants were used, and they have now been either banned or not permitted to import them into Australia because they did pose problems with antimicrobial resistance inadvertently in human medicine. Some, if not all, of these antibiotics listed there can be used without veterinary intervention. So remember I said that antibiotics used for therapeutic or prophylactic use had to have a veterinarian involved. These ones don't. But Australia does very closely regulate any kind of residual amount of these drugs in the food that we eat. And so there are things called withdrawal periods, which means they can't be used prior to an animal being used for food. So the second context in which antibiotics might be used in food production in Australia might be to prevent particular diseases that might occur more frequently because of production systems, maybe the number of animals in proximity to each other. So most of the really critically important antibiotics are either not registered or have very limited registration for use in production animals in Australia, and that differs from other places in the world. An example of a disease where the antibiotic is used to prevent a particular infection is, for example, in poultry, where a particular antibiotic is used to prevent a really severe intestinal disease called necrotic enteritis in broiler chickens. So they're the ones that you normally eat. Another example might be the use of virginiamycin that's used in feed to prevent an important disease called ruminal acidosis, a disease seen in cattle. Cattle fed high energy diets or highly concentrated food, for example at feedlots or when there's a drought condition. So people say that Australia is the lucky country, and I actually think in terms of antibiotic resistance in animals, we've been the smart country. So unlike many other parts of the world who registered really critically important antibiotics like fluoroquinolones or third-generation cephalosporins, antibiotics that are used for critical infections in human medicine and in animal medicine, Australia has been smart enough, in the case of fluoroquinolones, to never register these antibiotics for use in livestock. In the case of third-generation cephalosporins, they have very limited registration, so it's one particular type of antibiotic and it's only specific diseases that it can be used in, such as respiratory disease and foot abscesses in cattle. Antimicrobial use has also been tightly regulated and restricted in chickens, so there's actually very few antimicrobial agents that can be used in meat, chicken and laying hens for human consumption. So how does Australia compare in terms of how much antibiotics we use in production animals and the level of antibiotic resistance in our production animals? So since the early 1970s, all medically important antimicrobials given to animals need to be dispensed by a registered veterinarian, and that's actually different to some other places in the world. For example, in the USA, 98% of antibiotics that are given to animals are dispensed over the counter to the owner or producer, and so the animal doesn't have to be seen and the veterinarian doesn't have to approve those antibiotics. If we were to compare Australia to the European community, we would have the fourth lowest use of antibiotics in production animals. So there's a big difference between, for example, Italy, which is the highest, and Norway, which is the lowest, in the amount of antibiotics that are used in production animals. So it's actually very good news that Australia, considering how intensively we produce food and milk and produce like that in this country, that we would be one of the fourth lowest if we were part of the European Union. This is translated to very low rates of antibiotic resistance in production animals in those really important bugs like E. coli and Salmonella. So this slide is stolen from Professor John Turnage's presentation. And it's just to remind you that while 2/3 of all antimicrobials in Australia are given to animals, this is over 600 million food-producing animals, plus companion animals on top of that, whereas we only have 24 million humans. Other thing to remember is, except for poultry, humans weigh much less than most of our food-producing animals like cattle and pigs, and so the dose given to a cow or a pig would obviously be much higher. So what evidence do we have that the lower use of antibiotics in food-producing animals in Australia and the restriction on the type of antibiotic we use in Australia is having a positive effect? Some independent studies done by Food Science Australia in 2008 actually took the poultry and pork chops and beef mince that you might purchase at a shop, and these shops were in Melbourne, Sydney, Brisbane and Perth, and they looked for presence of bacteria and tested them for antimicrobial resistance, and they found that there were none of these organisms that had any fluoroquinolone resistance or third-generation cephalosporin resistance, and actually had very low resistance to other types of less critical antibiotics. The poultry industry, the pig industry and the cattle industry are working very hard to actually decrease their use of antibiotics, particularly in that area of preventative disease use. So the poultry industry is certainly supporting leading edge research to develop vaccines to prevent that really nasty intestinal disease I was talking about earlier. The pig industry is spending millions of dollars on projects to make sure that they can do everything they can to replace the use of antibiotics. And the cattle industry, say for example in feedlots, closely monitor their animals to make sure that animals with respiratory disease are early identified and separated from the herd so that the use of antibiotics in these animals is reduced. So in another study conducted in 2013 and 14, which I've been part of, has looked at antimicrobial resistance in two major groups of bacteria, E. coli and staph. They're a really important cause of disease in animals and humans. And it's looked at the samples that have been submitted by veterinarians to veterinary diagnostic labs. We've analysed those to look at levels of antimicrobial resistance against a whole range of very important antibiotics. We're really happy to find that in livestock we had very low levels of antibiotic resistance, particularly against some of those critical antibiotics. And in companion animals, I think we need to be a bit more cautious. Certainly the levels of resistance of E. coli and staph was higher than that in livestock and comparable in some instances to that seen in humans. So this is an area where antimicrobial resistance does need greater attention. So how might vets and the agricultural industry be contributing to antimicrobial resistance? There's certainly times when the use of antibiotics is inappropriate. The diagnosis of an infection is not supported, but they might be used anyway, just in case, to make sure we don't miss an infection. There's certainly some complacency about our ability to fix infections. Both of these two things are beginning to be addressed with a greater attention on the need not to use antibiotics and looking for alternatives. It is quite expensive for owners and producers to do diagnostic testing to determine and verify that a bacterial infection is present. Vets need to be thinking more about the use of topical therapy for localised things like skin conditions, and make sure they're not using any kind of oral or injectable antibiotics when they don't need to. Particularly in small animal medicine, which is where I practice, the concurrent use of cortisone and antibiotics is not infrequently used, and this is often seen in animals with allergic skin disease. So there's certainly a lot of educational programs through our dermatologists and directed towards our students to make sure that vets of the future are not using these kinds of methods. Vets, particularly in companion animal practice, need to consider much more the use of any antibiotic of critical importance to any of their patients. And in agricultural industries, and in particularly intensive industries like pigs and chickens, certainly those kind of production systems increase the susceptibility or the likelihood that an animal will get a respiratory, like a chest infection, or a gut infection, an intestinal infection. That's often to do with their close proximity and having large animals together. The profit margins in production systems are really quite low, and they are driven by consumer and distributors' need. And so we have to be very careful about this tendency for prices to be driven down, perhaps by supermarkets and other people like that, and the best example is, of course, the milk price currently. It's been driven by global problems, but also being driven by the competitive nature of supermarkets. For industry to change, there needs, of course, to be a cost and productivity incentive to find alternatives to antibiotics. Industry doesn't want to use antibiotics, and so they really want to find solutions to make sure that they are not used. So my take on some of the comments and questions that you're asked to look at: will making antibiotics significantly more expensive help? As I said before, owners and producers actually already pay the full cost with no subsidies, and those costs that, say, go to producers will eventually be passed on to you, the consumer, or reduce this already slim profit margin. So what about prohibiting antibiotics from being dispensed on the day of prescription? I think this is particularly problematic, so I think if you really don't think that an animal needs an antibiotic, then you should simply not give it. It might be okay for non-critical infections, say like skin, but if you've got a serious infection, and such as those that are needed to be treated in hospital, or patients who've got other diseases like heart disease as well as the infection they've got, you really put that animal at risk. And unlike you or I, where we might be given a delayed prescription for a respiratory infection, and if we feel better in 2 days, we'll go, you know what, I won't fill in that script, I'm actually feeling better. This concept in veterinary science would rest on the ability of the owner or the producer to assess where the animal is better, And really, it would be better off having a second examination by a veterinarian determining then. Prohibiting or severely restricting veterinarians from prescribing antibiotics of last resort. I think this already occurs in food-producing animals, so these drugs are already either prohibited or there's severe restrictions on their use. Perhaps greater restrictions could be placed on use of third-generation cephalosporins. It certainly could work well for orally dispensed medications, and that would require changes in the registration, particularly of certain antibiotics used in small animals. It would be problematic for critically ill patients in hospital where the use of an injectable fluoroquinolone third-generation cephalosporin in critically ill animals might be needed. You might be able to think about a special permit for their use for every instance, and an audit of use would be an important first step. So on this concept of banning the use of growth-promoting antibiotics in food-producing animals. So there's already considerable bans on the use of antibiotics in Australia, and severe limits on those not considered of importance to humans. And I think perhaps rather than banning, the way we should approach it is pretty much like the RTA is approaching the road toll, that we should be working towards zero. So we should be funding through research from government and industry, and both of those things with universities in combination, to strive towards zero. And this would take, a program over several years to identify those big diseases that are used, for example, where antibiotics are used, for example, in production animals, and target those to find alternatives like vaccines and other things. Asking a veterinarian to hang a signed poster in their consulting room pledging to only prescribe antibiotics when they're needed. It'd be good. It's part of an overall plan or goal to reduce antibiotics. Like all prescribers, I think there's a bit of pressure on us sometimes to dispense medication. And really, all prescribers, vets, dentists and medicos have to rise above that and kind of get over it and really hold strong on that. And I think it would be helpful. You've got to remember, though, that not all animals walk into a waiting room, that many large animals are part of an ambulatory service, so the animal is seen when the vet drives to the property. Last point that I think you're asked to consider is requiring veterinarians to write a justification on the patient's record every time they prescribe antibiotics. To be honest, this should already be part of the clinical record. So every time we see an animal, we have to write exactly what's wrong with it and make an assessment on why a particular drug is being used. That's what constitutes a good clinical record. So each clinic in veterinary practice has its own clinical record system. Majority of those are now electronic. And if we are asked at any time by the New South Wales or any state board, the practitioners board, to produce that record, we have to produce it legally. So that's our legal record of saying, this was what I saw with the animal, this is what I treated. Now, writing a justification should be there already. If we were going to require this, then you would need some kind of auditing of clinical records. And so you would actually need to fund that. Logistically, it's a bit difficult, and it obviously would require funding. Thanks for listening. Happy to take any questions you have.